everybody, we have an excellent doctor for you to listen to. You know, we go to doctors and we should bring our lists of what's wrong with us, but many times we don't. And you're so happy to see a doctor. Usually you just say, I'm feeling fine, and you're really not. Dr. Alex Rosen, he is really here to tell us about when you go to a doctor and you see Dr. Rosen, you have to know what to ask him. He's going to ask you, how are you feeling, of course. But Dr. Rosen, what do you find that people do when they come in and they're not so honest about what they're feeling?
Well, I mean, sometimes you see it more in, I think, men than women. The men don't like to talk about their health problems as much. I guess it's a gender thing, but a lot of times when it's a husband and wife, the wives insist upon coming into the room and they'll say, well, we'll tell them about this, tell them about that. So it's probably good to have the spouse in with the patient, especially I think that for men, especially, I find that they don't mention all their problems up front. But that's been my experience. The wives are much more concerned or in detailed about it.
Well, Dr. Rosen, you're a man, and I'm sure that you're more quiet about things, not necessarily when you go to a doctor, but men, you're right. Most men are more laid back. And when a wife is involved, that's true that she does it. I think it's rare that it's the opposite way, that the man says, tell him, honey, tell him, right?
Yeah, much less common than for the men telling about the wives.
Well, well, go ahead, Dr. Rosen. I wanted to ask you about that, though. I think people should always bring someone with them as they get older. Shouldn't they bring someone with them when they go to the doctor?
Yeah, I definitely agree with that. Very often, as people get older and then they don't have the memory they used to, usually the children or the daughter especially will come and advise the doctor about what's going on, or a caretaker or a wife. But if there's usually someone to help the doctor understand what's going on, family or close friend.
Yeah, that's true. And a lot of times they have hearing problems or they have vision problems and they're not even getting the information.
Yeah, that's true. You know, they have trouble filling out healthcare forms because of the vision or the understanding. You know, there's a lot of paperwork nowadays. Some offices, we don't do it here, will hand them, you know, an 85-year-old a computer tablet to fill in their
Right.
medical history, and they're looking like, you know, it's not going to happen. So, you know, you got the technology is getting beyond their abilities, but you know, it's always recommended for patients to bring in list of their problems, and that helps the patient. You know, they have clues of what's bothering them, or they write them down, and then it'll be a good reminder to them. I mean, I'm always amazed how, you know, a little 2x2 paper, you know, there's like 150 complaints on, I mean, how much stuff they can get in on a little piece of paper, but they can do it, and they, you know, and that helps too when it's written down.
Right. Well, Healthy Partners is an excellent organization, and what you just said is true. So you're aware that you can't just shove a tablet at an older adult, tell them to sit down, fill it out, and they're not going to be able to do that.
No, no. Some, you know, some of the patients are extremely computer savvy, you know, unbelievably so. You know, they do FaceTiming with their family and their children, and they, you know, do well with cell phones or the smartphones. But, you know, a lot of people have trouble with using cell phones, smartphones right nowadays. Hard for them to keep up with that, the technology, which changes almost every day.
But yeah, that's true. And thinking about their vision maybe it's not as good either. So trying to read those tiny, I don't know why. A lot of forms are so tiny, I can hardly read them.
No, yeah, it's very, they're lengthy, they're hard to understand and they're complicated. But hopefully they'll get to the part where they tell us why you've come to see us today. What's the reason for the visit?
Well, you brought up a good point. A lot of times they'll say, why do you need to know about my mother, my father, my brother, my sister, what they had? Why don't you explain to our watchers exactly why that's so important?
Well, when the family history is important, especially someone in their, middle age, 50s, if there's history of diabetes, cancer, we focus on the screening more specifically, or what kind of workup or lab work. I mean, sometimes I feel it's a little bit overdone where, you have a patient who's 95 years old come into our office and the nurse is like, what did your parents die from 50 years ago? And that kind of information is interesting, but not that helpful. But especially younger people, it's much more informative.
Right, when you're 95, I mean, you've made it no matter what, right?
Yeah,
So,
if you're 95 and they say, well, my mom lived till I was 100, she was 100, and their family history is very, very positive as far as their longevity. But I always get a kick out of seeing if patients who are 95 remember what their mother passed from so many years ago.
right.
But we still ask it because it's part of the routine medical charting, even though the practicality sometimes isn't makes sense.
One thing I want to talk to you about, though, is of course, I know that when people have to go to the doctor, especially women, they spend all day getting ready because this is their big event.
Yeah.
And you have to, as a physician, and I'm sure you do, but you have to appreciate why they've come there because this is their big day and they need to have a little socialization, even though I know you're a busy doctor, but just to be a little kind and to be a little bit empathetic with them. So I know I've heard that you're very good at this, but I'm talking to people out there. When you come to see a doctor, remember they're busy, but they also are very caring people. This is not just a doctor with a white coat on. You had to go through a lot of education, and you're experienced and you understand that. I think that a doctor can help people be better just by, even without medicine, by just being caring.
Yeah, absolutely. I mean, you could tell a lot about a patient, what their appearance is when they come to the doctor. I think is what you mentioning about women getting dressed up. You do have patients that come in who look unprepared, not dressed well, not groomed, and it makes a light bulb go off that there's something wrong here. You think these people are not taking care of themselves properly, especially elderly. So it tells a lot to the doctor how the person looks. I mean, you get patients, a lot of women especially, they're dolled up, they get their makeup on, they look fantastic, they have nice, clean, sharp clothing matching, they look like their jewelry on, and you can tell they're well put together for their age, and it's impressive how they are concerned how their appearance is, and they were used to doing it when they were younger and they don't stop. That's how they enjoy looking good. So appearance in general is helpful to the doctor to assess what's going on at home, I think, too.
My guest is Dr. Alex Rosen. He's with Healthy Partners, and we're having a very important conversation. This is not about particular medications. This is about the human aspect of seeing a doctor, and Healthy Partners is famous for having very good doctors who really care. I know that's one of the highest priorities for them, but I want to now move a little further with that. So let's say someone that has just lost a spouse. What
Right.
kind of advice and what do you do there with somebody? What can you tell them?
Yeah, I mean, obviously there's a more long period of mourning and, sense of loss with these patients. You try to, there's counseling involved, especially if a spouse passed on from cancer or something in that range. There's professional, social, and help with dealing with mourning, like hospice patients have the hospice people help the spouses and family, get through that difficult time. Sometimes, medication is needed for depression if you find that they're really in a bad way. You try to hook them up, hope you try to assess their family situation or their children around or grandchildren that they could rely on in this time of need. If they're by themselves, sometimes that's an issue. They're all alone now. And then, if it's a man lost his wife and the wife did everything for him as far as shopping, meal preparation, doing the finances, the checkbook, they're really going to be lost. So you have to try to figure out how to help. Sometimes there's social, you can find social workers to come to the house, home health people to try to help them through that. Every situation's different. Sometimes the spouse, that's still surviving spouse, can't be by themselves for various reasons, or they have cognitive problems. They need to move in and with a child, or they need to move to a assisted living where there's help. I mean, every situation is different, but some people just can't be on their own, live alone. But that's, we're trying to assess, what their needs are essentially.
Well, you brought up cognitive. I'm glad you did that because I'm sure that you've explained to people that a lot of times they think that they're losing their memory after they've just lost a spouse.
Yeah.
Not that they've lost their memory, is it? It's they're just so
There's
so
the
sad.
sense of loss or depression over its sadness. Yeah, it can affect their memory. It's a temporary thing, thankfully. But you try to help them with their medication. There are people that can come to their house and set up their medication for them. There's things that we can do to help see them more frequently, check on them a lot more than would be in normal routine visits, to assess their health, status of their health, make sure they're not losing weight, assess their nutritional status, make sure they're eating properly, or doing some activity, or trying to find. I always ask, do you have friends, or what are you doing? Are they, do you have a card game or whatever activities to participate, or something that they keep their mind active. But it's a tough process for people and the elderly who have been married for 50 plus years. It's a long time, and it's hard for them to lose a spouse.
And yet I'm finding now that many people in their 60s, 70s, 80s are finding new spouses.
Yeah.
Are you finding that?
They seem to meet other spouses fairly quickly. They don't like to be alone. Nobody likes to be alone. And you have two people who've just lost their spouses, or they've been. Sometimes it's friends. There's just two couples that have been like socializing for years, and one spouse of each side passes away. That friends meet each other. Some of the it seems like they can be, aggressive in trying to find another. When there's a new bachelor, the women
Right, look out.
look out. I mean, they'll especially if it's a man who's okay. I mean, the women know he's probably looking for a home cooked meal or
Right.
some comforting, and they show up at the doorstep with a nice a nice meal. I think that's the way into a man's heart, is a good meal, right? So, the- they can adapt pretty quickly, actually. It's amazing how people, I mean, if you lived well into your 80s and beyond, you're not a slouch. You're a tough person. You could adapt easily, and they find a way to do it.
My guest is Dr. Rosen, and we're getting a lot of good advice. See, a lot of times you go to your doctor and you're expecting to have him, of course, takes your blood pressure and he tells you about medication, but you don't get a chance to hear a doctor talk like this. That's why I love to interview doctors, because actually a doctor has, I think, a lot more responsibility than just to the physical health. I think it's the mental health, and that's what we're talking about right now. And I really appreciate you're doing that. I want to pursue this though. So let's talk about the medication as far as depression, because people are put on depression medication very quickly. Talk about that, please, to us.
Yeah, I mean, we tend to do that, I guess, as doctors, sometimes maybe too quickly, if in certain instances. I mean, it's difficult for patients to get into like psychiatry providers, for there's not enough of them to go around, and there's a very high need for them. But so the primary care doctors are seeing it as much more, and we have they have more access to us. Patients have sometimes trouble sleeping, or they're very anxious, or there's a whole bunch of things that's going on. But unfortunately, you got to be aware of side effects of the medications before you just jump to prescribe them. It depends on the patient itself. If it's just a situational depression from loss of a spouse, you may be able to give them something just for a short period of time. But for, especially patients who have a history of depression, even before something happened, this is going to just make it worse. And, a lot of times medications, more often than not help, in my opinion, choosing the right one, starting at low doses, following with them frequently, and assessing for side effects. One thing I always make clear to patients, like an SSRI type of antidepressant, takes 2 weeks or so before you're going to see a significant improvement, or at least a little improvement. Some patients get frustrated because it's not an overnight. They feel they're going to take one pill, one dose, and the next day they're going to be so much better. It doesn't happen that way. And then they'll just stop taking it, go, oh, this pill is no good. I tried it for 2 days and I feel the same.
I see.
You got to tell them, make sure they understand the expectations of what the medication can do, in conjunction with, socializing or speaking to counselors if needed. But it's part of the treatment, protocols is sometimes necessary.
Dr. Rosen, is that with all medications, like blood pressure? Is it really just with depression?
With them taking some delay in efficacy. I mean, depression is, a longer lag time. We're talking a couple of weeks. With blood pressure, sometimes you can get a pretty rapid improvement within 24, 48 hours. So, I would, blood pressure pills work a lot faster, I think. I mean, you don't have, the luxury of time with blood pressure. You want to get it down fairly quickly, but if it's really high. But in general, most medications take, a little while to have the maximum effect, for sure.
Well, that's good that you tell them. You see, that's the important part, that as long as they know and it's coming from their doctor. In fact, I've also often said to doctors, use your prescription pad, because that's what, is important to them, and send them home with just what you said. Now, this may take 2 weeks, or this, if you're having a hearing problem, please go to a hearing specialist. And then we didn't even cover, and I don't want to run out of time, but we didn't even cover people with dental problems and they can't eat properly. But you as the physician, you can really, they listen to you. You're their God. I hate to, I'm gonna have to say that word, but they respect you. And if you write it down, because they're not going to remember, but if it says such and such and such, they'll remember it.
Yeah, you're right. I mean, a lot of times we'll give them instructions verbally, and you can say it even more than once or twice or 3 times, and you ask, do you understand what I said? Take this pill in the morning, take this pill after dinner. Oh yeah, I got it, doc. It's okay.
Right.
And by the time they get home, they're like, what did he say? They don't really remember.
Right.
For whatever reason. And so if it's written down, it does help quite a bit.
Because doctors make them nervous. You're
Yeah,
special.
you're nervous. They're nervous. Is like, what did they say? What did he say?
Right.
So that it is important to try to, help that way. I mean, at Healthy Partners, we give them it's good when a patient checks out, they'll get a summary of the visit. So they'll go home with a piece of paper.
Oh, that's good. That's good.
To give them some instruction as well, which is good. They feel like they got something in their hand to go home with. And
well, Dr. Rosen, it's been wonderful talking to you. I mean, I think that people who listen to this will get a lot of information from it, sometimes more than just a physician talking about medication. You're very good. You can see you're very caring. And so it's Healthy Partners, and it's Alex Rosen. Okay. So Dr. Rosen, thank you. This has been really wonderful. Healthy Partners, and everyone will get information when this is set. We're going to put it on YouTube, and we really appreciate your taking your time. I know the patients need you, so I'm not going to hold you up anymore. But thank you very much. And